And what are the preventive and curative measures to overcome this pregnancy induced hypertension? Was regular antenatal checkup was prescribed. The pregnant mother should check gynecologist often to overcome this problem. And then calcium supplementation of 2 gram per day is recommended. Antioxidants like vitamin E and vitamin C with magnesium, zinc, fish oil and low salt diet was prescribed to women, that is pregnant women. And then balanced diet rich in protein is also prescribed for a pregnant women. And an increased risk of abruptio placenta and intracerebral hemorrhage may occur, and then renal failure may occur. So, in order to prevent this abruptio placenta means it is premature detachment of the placenta will occur in some cases. So, in order to prevent all these complications, the preventive and curative measures should be followed by a pregnant woman. The next important type of complication was gestational diabetes mellitus. It is also called as GDM. That is, it occurs only during this pregnancy period. Okay, after only in the gestational period, this diabetes mellitus will occur. It is carbohydrate intolerance. The seen for the first time during pregnancy. After 20th week of gestation, this may occur. What are the risk factors for gestational diabetes mellitus? Means due to the positive family history of diabetes mellitus in parents, and then history of previous stillbirth will be the risk factor for GDM. And mothers, if a mother's age is above 30 years means there is a risk factor for this condition, and obesity is also one of the reason for this GDM. How to screen this GDM, gestational diabetes mellitus means it is fasting plasma glucose level, that is it should not be above, that is 126 milligram per dl. And then high risk cases with a borderline hyperglycemia, raised blood sugar level, and OGTT is done. OGTT means that is oral glucose tolerance test will be done for a pregnant woman to know whether she is suffering from GDM or not. Prevention and management of this GDM, that is pre-conception counseling. Counseling is essential for a pregnant woman. And then regular antenatal care is essential for a pregnant woman, and the diet should contain 50% of carbohydrates, the 20% of proteins, 25 to 30% of fat to overcome this GDM. And the diet should be fiber rich, and then 3 meal regimen should be followed, that is breakfast comprising 25% of the total calorie intake, lunch that is 30%, and dinner 30%. Then prevention and management, again following, there is low calorie snacks should be followed, should be taken by a pregnant woman, and regular exercise, mild walking is prescribed for a pregnant woman. And then blood glucose levels in check, that she has to often check her blood glucose levels. And then frequent blood sugar estimation is also required. The next important type of complication was nausea and vomiting, that is it's a common complaint during pregnancy. The women after get pregnancy, she may suffer in the 3rd week and 4th week, and some women will suffer from the whole period of gestation. Okay, so it should worsen in mornings. 80% of women last throughout the day, and due to this condition it is also called as morning sickness. So it begins from the 1st or 2nd missed period, last till about 14 weeks to till 22nd weeks of pregnancy. What are the causes of this nausea and vomiting? Is the high levels of increase in hormone, that is human chorionic gonadotropin, pituitary hormone, and the high levels of estrogen hormones. This is the cause of nausea and vomiting. And the measures to reduce nausea is, that is eating small and frequent meals should be consumed by a pregnant woman, and foods rich in fats and spices should be avoided. Okay, and then taking a dry toast, rusk, biscuit before getting out of bed is a preventive measure, and avoid the food which triggers nausea. So she has to avoid the vomiting foods. Avoid dehydration, that is she should take adequate fluid, and in some cases medicines are also required to cure, to prevent this nausea. So heartburn and acidity is the common complication of a pregnant women, that is it's due to regurgitation. Regurgitation means that is flow in the opposite direction, that is food will be coming out in the opposite direction, that is vomiting. Okay, this condition is called as regurgitation. So increasing the size of the uterus compresses the stomach and the contents are pushed into the esophagus. So due to the compresses of the stomach, the food contents are pushed back into the esophagus. And progesterone also causes the relaxation of the lower esophageal sphincter. So these are all the important 7 complications of a pregnant woman. Okay, so hope you understand this presentation. Thank you, girls.